It's essential that integrated care boards and integrated care systems use evidence from research in all of the decisions that they make. And if you look at West Yorkshire, which has been a health and care partnership for 6 years, it's one of our founding principles, of which there are 5. But one of them is that we always agree the evidence upon which we make decisions and choices. And we always agree what it's telling us. And then we act. We don't need consensus to act, but we need consensus of what the evidence is telling us. And I think that that speaks to something which is a fundamental truth generally, and is a requirement particularly now. So I think culture and infrastructure are behind making sure that all decisions, wherever possible in the system, are evidence-based. And when I speak about the system, it's important to remember that integrated care systems are systems. They're made up of the organisations and the communities within which they sit. So in West Yorkshire, it's the hospital trusts, it's the GP practices, it's the charities, it's the councils, it's the communities themselves that make up the partnership. So knowledge and library services that sit within our hospitals and our other institutions are part of the ICS, the system. An integrated care board is just an organisation within that system that has to deliver a strategy with its partners. But I really want everybody to understand that this is a system and this is a new way of thinking and being. And that requires us to all see that and to use our strengths to deploy in the service of the purpose of that system, which is to improve outcomes. So to ensure that we have good evidence-based decision making, you need the right culture and you need the right infrastructure. So on the culture side, people like me who run organisations and systems need to speak openly about the value of research and evidence and knowledge, and we need to use it ourselves and role model that we must always try and base things on evidence, not assertion. People who are in clinical roles, people who are in public and political roles also need to do the same thing. So if we're going to make a difference, we need evidence, we need to prioritise, we need research, we need to look at what works, we need to experiment. None of us have been in this situation before. None of us. There are things that we can do and learn from the past, and there are experiments that we're going to have to learn together on in the near term. And I think knowledge and library services can be a fundamental part of that for us. And for me as a chief executive, I need that kind of input, that evidence, that support. Putting a knowledge management professional and capacity into integrated care systems is really positive move and really helpful. As I discussed, we need the infrastructure as well as the culture to embrace knowledge. And having knowledge and library services within the ICS and capacity to coordinate knowledge is incredibly important. You don't know what you don't know, as they say. And also, if you want to know the truth, ask a librarian. You know, you want the facts, so let's have them. And I believe that if we can get this right, we can succeed, because we do something which is, again, fundamental to the way we work in places like West Yorkshire, which is we try to connect the system to more of itself. We have these pockets, these islands of experience and knowledge, which we must visit, which we must connect, which we must amplify, really. And I think this is a really positive step. I think we've got a saying in West Yorkshire, which is real change happens in real work, which we stole from Myron Rogers, and I think it's the same for knowledge and library services. What's the real work you're going to do that's going to help drive real change, and what are you going to work on together to deliver that? you've got a whole raft of new customers. If you look at if you're in a library in an NHS provider, that provider is now in a collaborative with others. They are sharing capacity and resources, sometimes money. And why aren't you part of that sharing? What could you do to work with the other library services to create something which informs and affects the thinking of their boards of every organisation in that collaborative? Having a kind of ambitious outlook on the role that you can play and the difference that you can make in this context of collaborating in place or collaborating across providers is something that I would encourage all knowledge and library services to embrace. And if you think about that statutory requirement to have some capacity within ICSs, you've got somewhere to connect to. So connecting yourselves to more of yourselves, connecting yourselves to the system in places and across provider collaboratives is a positive. That's necessary, it's not sufficient. And then I think the thing to do is be of use. And in doing that, I'd go where the energy was. If you got people like knowledge, like data, like insight, go to them and give them an offer. And make sure the chief executives know that if they're worried, if they've got something that they need to make a decision about, you can pull together the evidence for them, a little compendium of, that might help. So I think being helpful and putting yourself in front of the right people is also something that people will need to do.